Okay, well, we're in the middle of discussing, but we're here with Dr. Rawra to talk about autism. And of course, it's such an interesting topic that we were talking off air and got caught talking on camera. Sure. But welcome.
Thank you.
Autism affects a lot of people in varying degrees, correct?
That's correct, yeah. So it affects actually 0.05% of children. And it's more common in males, 5 times more than in females. Basically, it's a neurodevelopmental disorder that affects children's ability to communicate, both verbally and non-verbally.
And people are still trying to research how this happens, right? I mean, does anybody really know?
So we have theories at this point. What we've been able to see within the brain, certain chemicals are increased, like serotonin and dopamine. That basically points to that there was some sort of insult in the perinatal period, so before birth and right after, that affected development of the brain.
How early will a parent typically notice something, and what do they do with that?
As soon as children are able to have any sort of communication, even nonverbal, eye contact, pointing to things, but by 3 years maximum, it will declare itself. So.
Yes, because you'll notice that perhaps they're not talking like a 3-year-old would be talking.
Yes, so language will be delayed, at times non-existent, and even when it is present, it's not very effective, their ability to communicate properly.
You mentioned empathy,
yes.
Ability to empathize.
Yes, so they not only have a difficult time expressing themselves, they also have a difficult time understanding communication from their surroundings. So that could be verbal, non-verbal communication. So if somebody's frowning at them, smiling at them, they're not able to pick that up, and that affects their ability to understand emotions around them.
Now, there seem to be different degrees, like there are some children with autism who cannot talk at all. Yes. And then there are some who seem to be pretty verbal.
Yes.
So that just seems to be different degrees, right?
Yes.
And what do people do? Are there treatments?
There is treatments. So again, this is a lifelong condition. There's no cure for it.
They will always have autism.
Yes. I just wanted to point out there's one more thing that comes along with this, some rigid behaviors like biting, head banging, pulling their hair out. So that can be very disconcerting for family members.
Can that be controlled by keeping a routine?
Well, a routine helps. A rich psychosocial environment, basically a contained environment is helpful. There is apps out there nowadays with technology. There's actually a very good app out there. It's called My Words by Jefferson Software, and it really helps children communicate better or be able to communicate better. And medications are used for things like when children are hitting their head and biting and those kind of things. Aggressive behaviors. Yes.
Thank you very much. We could talk all day about this. It's very interesting. Thank you very much for coming in.
Thank you. Appreciate it.
We'll be right back.